I'm going to talk a little bit about oral health strategies for the dementia patients, both in the prevention of dementia and for patients who are in extended care. This is another one that I put in the super difficult category. There are some real difficult issues here where they don't have a solution yet, okay? So let's talk about from the prevention standpoint. A recent study has linked the periodontal pathogen, PG, Porphyromonas gingivalis, having traveled to the brains of people with Alzheimer's. 40% of the Alzheimer patient samples had PG. 0% of the healthy brains that were studied had any periodontal pathogens. This comes back to this discussion that I keep having over and over again. PG is showing up in areas where bad things are happening. Cancer, heart disease, dementia. If I had a choice and I'm a preventive-oriented person, I don't want PG in my body if I had a choice, okay? So PG is a periodontal pathogen. It lives around your teeth and gums. And if you have a chance to eliminate or keep it to a very minimal, it's just common sense that at the level of research that we have today, you don't want PG in your mouth, okay? So what are we going to do? We're going to screen for those pathogens that are implicated. That's a part of the oral DNA screening. Video microscopy, and this is the oral DNA. This is the sheet that shows how the bacteria go from the necks of your teeth into your arteries and into your circulation. This is the oral DNA, advanced salivary diagnostics. This one right here is the test for PG, okay? If you have elevated, highly elevated PG, you know, it's not a good thing. I don't have any problem in telling you. Okay, so we want to reduce the bacterial load of the bad pathogens. And actually, in this slide right here, that black line is the bacterial load line, meaning if you cross that line, you have additional risk, okay? So, once again, for the prevention of, to get you in a maximum preventive mode for all of these things, we need to get you in an oral disinfection protocol, get you stable, okay? Now, and the other thing too is the long-term regimen, product recommendations, the home care. This is all very, very similar. Home care products, a recare interval with a hygienist. Once again, these things are very similar. Now, let me talk specifically for patients in long-term care. This is the area that I don't have the answer. This is an area that dentistry isn't talking about because it's nearly impossible. This is oral care for patients in, extended care facilities with dementia. You are depending on the help that have an extremely challenging job on a day-to-day basis to provide some level of oral care. I know it's minimal, and I know they're not using the approaches that I'm talking about with antimicrobials, and you can't, okay? So one of the things that I've seen recently was a group, and I can't remember exactly where, but someone was advocating a hygienist to come in and do weekly care. And they were, and on the surface I'm going, that's probably what it would require to get optimal care. I know that I've had dementia patients in my practice that we saw every 4 weeks, which, that was minimal. That was minimal. So this is an area where I really don't have an answer, but I can tell you that, we can have conversations with the professionals and try to create a protocol that can be done in an extended care facility that at least is the best that we can do, but I can assure you that it's not going to be optimal because this is one of those areas in medicine where it's just a giant question mark as to what can we do that's the absolute best thing for these patients.